So, as we've talked a lot about CalAIM and Medi-Cal RX, we thought we'd spend a little bit to provide some clarity for those of you that might be new to all of this and might not really understand, what is she talking about, Medi-Cal managed care? What does that mean? Well, if you look at it this way, Medi-Cal managed care, there's about 95% of all those on the Medi-Cal program in California are in Medi-Cal managed care. There's a smaller portion, mostly those who have CCS eligible conditions. So the children age 0 to 21 that are on CCS, which would include those with hemophilia and von Willebrand, who are either children or young adults that are on CCS, they would be primarily in Medi-Cal fee-for-service. There's a smaller subset, about a third of the CCS kids are in Medi-Cal managed care through what's called the CCS Whole Child Model Pilot. So Medi-Cal fee-for-service is where you go to your doctor and any other healthcare provider, and the services are paid for each service performed. Patient usually has a broad choice of providers in their networks, and the state can create different payment methodologies for that, but mostly the main message to understand is if you're in fee-for-service, you pretty much can go anywhere you want as long as it's in the network. With Medi-Cal managed care, you're a little bit more restricted on where you can go, and the state does attempt to manage the finances of that system of healthcare. But it can also work really well if you can get to your providers and if they're in the system or in the network.